Hello everyone, a warm welcome to all you viewers. Our focus today is on women's health. A woman, as you know, has some unique lifestyle and routine issues, and they're very specific to women, not so specific to men. In fact, the words breast cancer and cervical cancer are so painfully used when it comes to women and cancer. And so today's sessions are all about women's health with an emphasis on cancer, incidence, screening and prevention. Our first speaker is Dr. Satya, an internist and gastroenterologist from Houston, Texas, USA. She has a wealth of experience, and she is the founder and CEO of the NGO which is known as the Collective Power of One International. She describes herself in her own words as recklessly abandoned. We're so privileged to have Dr. Satya on our show today, and we are very eager to see and to hear what she has to say to us.
Greetings from Houston, the Lone Star State of Texas, USA. I am Dr. Satya Kalangi. My colleagues and I are honored and privileged to speak on this great platform. Thank you. Our topic of discussion today is a lesson on female health awareness. We hope to share about the importance of women's health, prevention, or detection of breast and gynecological cancers. Why is women's health so very important? Because healthy women are the cornerstone of a healthy society. On solid rock and firm foundation only can we build a home, a family, and a society. She is the best investment. When women have access to quality health care, it leads to improved health of the children and the families as well. Women then typically develop an augmented sense of overall well-being and a greater inner joy and peace. This in turn results in a remarkable boost of productivity, self-sufficiency, and independence, of course, often leading to greater longevity. Furthermore, healthy women contribute to noteworthy increase in economic progress, advancement, and development of a society, thereby empowering both the individual and societies at large to sustainability. More importantly, creating a snowball effect of added significance, thus causing generational change. This clearly drives home the fact and acceptance of the need for interdependence, the great equalization of the value of both genders. Truly the collective power of one international. Well then, what is the definition of health? According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. As each of you know, particularly the women in the audience, that our roles are a multitude, a myriad of unending tasks, becoming the perfectionist, the superwoman syndrome. Yeah. Unfortunately, though, in some societies, the phenomenon of feminization of poverty affecting women and girls is of particularly a grave concern. Poverty not merely in the monetary sense, but poverty of spirit, thought, emotions, and actions. The single parent, the physically, mentally, and emotionally abused and battered woman, human trafficking, maternal deaths, malnutrition are just a few examples. Woefully, this is further exacerbated by deep-rooted discriminating and socio-cultural norms. Therefore, education and awareness are the key to change of mindsets and behavior, just critical. There are numerous health concerns of women, many non-communicable diseases, non-infectious diseases, which include a variety of spectrum. These generally are chronic diseases with not an immediate cure as such. Diabetes mellitus, hypertension, coronary artery disease, chronic respiratory diseases, malnutrition, obesity, and more. The morbidity and mortality of these diseases further causes an increase in global healthcare burden and cost. Mental health is a much neglected area globally as well. A silent killer, anxiety, depression, and the like. And of course, the big, bad 6-letter word that starts with a C. Yes, cancer. Cancer of the breast, cervix, and the uterus. So, what is cancer? According to the World Health Organization, cancer is a large group of diseases, a growth of abnormal cells that lack control or boundaries, resulting in spreading to the adjacent tissue or even to the distant organs. It can begin in any organ or tissue. Cancer is the second leading cause of death globally. In 2018, it is estimated that cancer accounted for about 10 million deaths. That is 1 out of every 6 lives. Breast cancer, however, is the most commonly diagnosed cancer in women. That's a staggering 24% of all cancers. Globally, the incidence of breast cancer is highest in Asia, followed by Europe, North America, Latin America, and then the African continent. Breast cancer is also the leading cause of all cancers, deaths in women, 15%. Ironically, breast cancer also occurs in men. Fortunately, however, these are rare. But men, beware. 1 in 28 women develop breast cancer during their lifetime. Sadly, every 2 minutes, a woman is diagnosed with breast cancer. Every 13 minutes, a woman dies of breast cancer. The incidence is on the rise, as evidenced by the number of diagnosed cases in 2008 versus 2018. Fortunately, the death rates are declining, with an increase in awareness and early detection. This is a result of education and awareness. Together, let us celebrate October as the month of breast cancer awareness. Stay tuned for invaluable nuggets shared by highly distinguished and globally renowned speakers. Coming right up. Thank you.
Thank you so much, Dr. Satya. That was really very, very valuable information. And we are so grateful to you for spending your time sharing this information with us. Friends, we're still in the international space. We have one more doctor from USA, more specifically from Texas. And more specifically, we are moving into a more specific topic. And we have Dr. Dixie Melillo, a breast diagnostic specialist. She currently has a private practice in general surgery limited to diseases of the breast, affiliated to HCA Houston Healthcare. And let's hear what Dr. Dixie has to say to us today.
I'm Dr. Dixie Melillo. I've been a doctor for 42 years now, and in most of my career, I've taken care of breast cancer patients. I've taken care of breast disease, breast cancer. I've seen a lot of changes, a whole lot of changes in prevention, in detection, in treatments over these years. I started my career as a surgeon in the 70s, and at that time we were doing the radical mastectomies, which means taking the breast, taking all the lymph nodes, and taking the muscles off the chest wall. If ever there was a deterrent to early detection, this was it, because when people saw their mothers or their grandmothers with a horrible scar like this, they wouldn't go in until the cancer was too late. Luckily, by the time I got in there, we were doing what we call a modified radical mastectomy, which means you leave the muscles, you still take the breast and take the lymph nodes for an invasive cancer. For a non-invasive cancer, no matter how little, they would still take the whole breast. And I was so happy in the 90s when we absolutely found out that you could do a partial mastectomy, which is a lumpectomy. You just take the cancer out with a good surrounding margin, and you sample the first lymph nodes that drain the breast, which are called the sentinel node. 97 to 100% of the breast drains through these nodes, and if they don't have cancer in them, then you're pretty sure that it hasn't gone someplace else. Then, of course, they added radiation to the breast. But women were very satisfied with this. They would come in because, it wasn't going to be a horrible, disfiguring thing. But what we're seeing now is a different kind of cancer. This cancer doesn't need estrogen and progesterone to thrive. It just takes off, and it's very aggressive, and it's in younger people. And what this is correlated with, though, is the obesity crisis. As we see more and more people obese, we're seeing this kind of a negative hormone receptor cancer that almost spreads before you can find it. It's just very, very important to understand that what we eat is so crucial in about 95% of our diseases. Heart disease, Alzheimer's, diabetes. Type 2 diabetes doesn't fall on your head, you create it. I've had so many patients tell me, well, my parents all had diabetes and my family has diabetes, so it's genetic. I said, no. You guys eat the same food is why you have diabetes. It's not because you have a gene for it. Type 1 diabetes, true. Now that's a pancreatic damage, that's a different thing. But type 2 diabetes is something you create by yourself. Now, prevention I think is absolutely important, but exercise is important too. Exercise increases your tumor killing cells and it circulates them. There's no crossword puzzle that can make your brain do better than exercise. Exercise provides blood flow. It provides growth factors that make new brain cells. We used to think we only had a certain amount of brain cells. No. We can make new ones in the right environment. And exercise will do that to you. Exercise helps you control your diabetes. It's very, very important to strengthen your muscles as you're getting older, because when your balance fails, and it will keep you from falling. Exercise is good for your heart, your blood vessel. It's good for everything. So exercise is also a very important part of prevention. But along with prevention, early detection. We have the ability to detect cancers early now. That's why it's so important that women know about all of the modalities. One of the most important modalities is self-breast exam. It doesn't take but a few minutes. You take the flat part of your finger, you go over your breast. The breast normally feels kind of like a little bumpy cauliflower with a little bit of fat on it. Some people have more cushion over their cauliflower than others, but it feels a little bumpy. You can check up under your arms, check all the way up here to your collarbones. Look at your breast. Look for a change in color. Look for nipple retraction, skin dimpling. Any kind of change, you need to report to your doctor. The coloring bright red coloring, sometimes it's infection, but sometimes it can be a very inflammatory breast cancer. So you need to be very vigilant about your own breast health. I've had patients tell me, I just can't feel anything. It's so lumpy. Well, no. If you don't check it regularly, you're not going to know how it's supposed to feel. And if you don't know how it's supposed to feel, you're not going to know if it changes. And don't wait for it to hurt. Cancer doesn't hurt. It has no nerve cells in it. It can happen in a breast that's sore now. Mammograms are wonderful. Even the best 3D mammogram will miss cancers. I've been doing this long enough to know. I see sometimes 20 patients a day and each one of them has a mammogram. And you can't, if the tissue is dense, you've got to do an ultrasound. Ultrasound is crucial and it's underutilized. And you've got to examine the whole patient. We women ought to insist, if you're going to do an ultrasound, do both sides and look at the lymph nodes. Extremely important that you get your yearly mammogram. If your breasts are dense, do the ultrasound. Do your self-breast exam every month. You are really going to have to play a really important role in saving your own life in this. And remember, food is medicine. Quit killing yourself with food. Take care of this wonderful body that God gave you. I thank you for your attention, and do take care of yourselves. Food is medicine.
Thank you so much, Dr. Dixie. What you shared with us was so valuable, and I'm sure our viewers are extremely privileged to hear all those valuable insights from you. Thank you ever so much. Friends, we had two doctors from the United States giving us a kind of a global perspective on women's health, especially on cancer incidence, prevention, screening. And now let's move our focus to India. We have the very reputed Dr. Madhumati Sanjay, MD Obstetrics and Gynecology, Senior Consultant at Apollo Hospitals. Her area of special interest are high-risk obstetrics, adolescent gynecology. She's published several papers. She has leadership positions even today in several associations related to obstetrics, gynecology, reproductive biology, and it's our privilege to have her here on the show with us. Dr. Madhu, we are just so keenly awaiting to hear what you have to say to us, not just from a woman's perspective, but maybe adding that extra perspective of women's health and cancer, etc. in India. So please feel free to share your heart out with us. Thank you very much.
Thank you, Pramod. Today, as we are talking about cancers which are unique to women, we now move on to the gynecological cancers. So what are gynecological cancers? These are cancers that start in a woman's reproductive organs, which would mean the commonest, which is the cervical cancer, the uterine cancer, the ovarian cancer, and the much rarer vulval and vaginal cancers. Now going on to cervical cancer, this is the commonest gynecological cancer. Cervical cancer is the second most common cancer in women living in less developed regions, with an estimated 5,70,000 new cases which were reported in 2018 alone. 84% of these were from all over the world. Cervical cancer is caused by sexually acquired infection with certain types of human papilloma virus, especially the types 16 and 18, which cause about 70% of these cancers. Cervical cancer can be cured if diagnosed early, and hence comes the importance of prevention and screening, which we will be talking about further. What do we mean by the comprehensive cervical cancer control? This includes primary, secondary and tertiary. In primary is the vaccination against the human papilloma virus. The secondary prevention is screening and treatment of precancerous lesions, whereas the tertiary prevention is diagnosis and treatment of invasive cervical cancer and palliative care. Vaccines that protect against HPV 16 and 18 are recommended by WHO and has been approved by many countries for a regular vaccination schedule. Screening and treatment of precancer lesions in women of 30 years and more is a cost-effective way to prevent cervical cancer, because precancerous lesions take a very long time to become invasive cancer, so this is a very good way to reduce the burden on the society. Coming on to primary prevention of cervical cancer, this involves the HPV vaccination to the girls aged 9 to 14 years old before they become sexually active. This is the key point. Also, we know knowledge is power, which means educate these girls about safe sexual practices, including delayed start of sexual activity. One point to be remembered is HPV vaccination does not replace cervical cancer screening. It is important to continue to get screened for cervical cancer. Let us talk a little more about this HPV vaccine. Why get vaccinated at all? Some HPV types cause most of the cervical cancers, as I said earlier, especially the 16 and 18. Hence, it is important that we get vaccinated, because this also can cause cancer of anus, vulva, vagina and oropharynx. Is this vaccination effective? Yes, because it targets the HPV types most which cause the cancers and other common health problems. Why is it ideal to get vaccinated before the onset of sexual activity? Genital human papilloma virus is passed on from one person to another by direct skin contact during sexual activity. The protection from the vaccine is optimum only if taken before getting infected with HPV. Is the vaccine safe? Absolutely. It has been licensed by the FDA and CDC has approved this vaccine as safe and effective. Should girls who are being offered the cervical cancer vaccine, should they be screened? Not at all. Definitely not recommended if they are given the vaccine before the onset of sexual activity. Once vaccinated, should women continue to get screened for cervical cancer? Yes, definitely. Because there are also some other HPV types which rarely can cause cervical cancer, hence the screening must continue. So how do we screen women for cancer cervix? There are 3 different types which are recommended by the WHO. The HPV testing for high-risk HPV types, the visual inspection with acetic acid called the VIA, or the conventional Pap test, and the liquid-based cytology. When do these women get screened? Right from 21 years of age till about 65 years. They should be screened every 3 years if they are getting the Pap smear done. If they are doing the HPV testing, then they should be coming in for screening once in 5 years. Going on to the other gynecological cancers, though a little rare, but what is important is that you need to be educated and aware of all the signs and symptoms, because there is no effective and reliable screening methods for these cancers. So going on to uterine cancer, the risk factors are if you're age above 50, if you're obese, are you taking estrogen replacement therapy without a progesterone protection, past history of subfertility, or if you've been one of those women who've had less than 5 periods in a year, or if you've had family history of uterine, colon or ovarian cancer. Please remember, keeping a healthy weight and being physically active may lower your chance of getting uterine cancer. So be active, move, exercise, any form of exercise, 45 minutes a day for at least 5 days a week would be effective. So what are the symptoms? As I said, there is no simple and reliable means to screen, so you need to be aware about the symptoms. Abnormal uterine bleeding in the perimenopause, that is around the menopausal age or after you have attained menopause, associated sometimes with pain or pressure in the pelvic area. Going on to the next gynecological cancer, which is the ovarian cancer. Why are we worried? Because women who present to us with ovarian cancer, because the symptoms are so subtle and seem to be so common, they present to us very late. So in an advanced stage of cancer, which may not always be very easy to treat. So what are the risk factors? If the woman is middle-aged, or especially those above 60 years of age, if they have close family members, say your mother, sister, grandmother, or on your paternal or maternal side, somebody's had an ovarian cancer, then you may be at risk. Having a genetic mutation called BRCA1, BRCA2, or 1 associated with Lynch syndrome. Or if you've had breast cancer, uterine or colorectal cancer earlier, or a past history of endometriosis or infertility during your reproductive age group. Please remember, I am reiterating this again and again, that there is no way to prevent ovarian cancer and there are no reliable screening methods. But you may be safe. You may be safe if you've had birth control pills for at least 5 years, or you've undergone tubal ligation as part of family planning, or along with your hysterectomy, your tubes and ovaries were removed. You've given birth to a child or breastfed for at least a year. These are not recommendations, but these are definitely some few things that might protect you from getting an ovarian cancer. What are the symptoms? Vaginal bleeding, especially if you have gone past menopause, or any abnormal discharge from your vagina which is not usual to you. Pain or pressure in the pelvic area, you could have abdominal pain or back pain, feeling bloated most of the time, not interested in eating or feeling too full too quickly, a change in your bathroom habits, either constipation or frequency. All these could be symptoms. All these are not definitely the symptoms, but please learn to listen to your body and report to your doctor if any of these untoward symptoms have been observed by you. The rare cancers of the gynecological section are the vulval and the vaginal cancers, which are about 6 to 7% of gynecological cancers in the USA. Now the risk factors are if the woman has had HPV infection for a long time, or she's had cervical precancer or cancer, or vulval or vaginal precancer, if she's a smoker or has had chronic vulval itching or burning sensation. We need to understand that again here, like cervical cancer, HPV is a cause. And again, I am reiterating about the HPV vaccine, which is so important, which will not only protect you against cervical cancer, but also protect you against vaginal and vulval cancers. It needs to be given to girls who are around 9 to 12 years old. It is also recommended through 26 years of age. But then yes, if they've already started sexual activity, they will need to be screened, but still they can take the vaccine and they will be protected. Beyond 27 to 45 years of age group, if your doctor recommends, yes, you can take it. Going on to the symptoms of vaginal cancer. Vaginal discharge or bleeding that is not normal to you, especially if there's postmenopausal bleeding, a change in the bathroom habits, or if you're having pain and pressure in your pelvis and lower abdominal pain or between your thighs, or if there's pain during sexual activity, then these could be symptoms that could be pointing towards vaginal cancer. Going on to vulval cancer, if there's intense itching or burning sensation or bleeding around the vulva, a sore or a wart around the vagina or around the vulva which is not healing, the color of the skin of the vulva could be either deep red or whitish. There could be pain in the pelvis, or there could be pain during sexual activity. So any of these symptoms you notice, please do report to your doctor. As we come to a close of today's talk, I would want to reiterate again about the 7 cancer warning signs. Very easy to remember. You need to be cautious. So it's CAUTION. C stands for change in bladder or bowel habits. A is a sore which does not heal easily. U is for unusual bleeding from the vagina, the anus or the urethra. T is thickening or lump in the breast or elsewhere. I stands for indigestion. O is an obvious change in a mole or a wart. N is for nagging cough or hoarseness which lasts for weeks. So please remember these signs, which are the warning signs. How can we prevent? This cancer prevention is definitely in your hands. You now have the knowledge, and knowledge is power, like I already said. You have the knowledge of the signs that you have to be careful about. What do you do to prevent? You maintain a healthy weight. You exercise more, 45 minutes, at least 5 times a week. Eat healthy. By eat healthy, I mean let it be a predominantly plant-based diet. Cut down your consumption of alcohol. If possible, quit smoking. So these are the ways that we can prevent cancer. The 2 main things that we need to do is take the vaccine shots. There are 2 vaccine shots that you can take. Human papilloma virus vaccine, like I already said, which will protect you towards cervical cancer and vulval cancer and some more. And the hepatitis B vaccine, which will lower your liver cancer risk. Screening tests, very important. Get screened regularly for your cancer cervix or for colorectal cancers. Those in high risk, get screened for lung cancer. Those, please do your breast self-examination, which is very important. Go for your mammography screening and make healthy choices. This is totally in your hands to make healthy choices and stay away from cancer. This is how together we beat cancer. We run, we stay strong, we will be happy, and if we get it, we fight this together and we survive and we beat cancer. Thank you.
Thank you, Dr. Madhu. True to your reputation, that was so valuable, rich information available to all of us. I'm sure our viewers would want to view this again and again and learn so much from this. And we thank you all three, in fact. We thank you, Dr. Satya, Dr. Dixie, Dr. Madhu. You've given us so much to think about, and it's going to really transform the way we live our lives, in a sense, especially the women out here. And now, to summarize this, I'm going to request our dear Dr. Chinnababu, the robotic surgical oncologist with Apollo Hospitals. He's here. He's going to summarize all that we heard, and I'm going to hand it over to him. Thank you very much.
So to conclude today's female health awareness lesson, let me reiterate to you all that we need to focus on our health. Cancer affects everyone. Let us take preemptive action to prevent cancer. You can modify your lifestyle, thereby you can reduce the chances of you getting cancer. In these COVID times, what I have seen in my practice is majority of the cancer patients are presenting late. So the take-home message for today is, let us not ignore cancer in spite of COVID. You need to take care of your body. You have any abnormal symptoms in your body, please listen to them. Prevention is the key, and if you cannot prevent a cancer, early detection will definitely help in cure of the disease. So the focus is prevention, early detection, and screening. Most of the women cancers like breast cancer or cervical cancer, if you detect them early, we can cure them fully. So please be aware of the symptoms. Please take necessary vaccines, especially for cervical cancer. The HPV vaccine needs to be taken. Please remember that you need to adopt a healthy lifestyle, healthy eating habits. Beware of what you eat, because food is medicine. Let us embrace healthy lifestyle. Let us embrace physical activity, and together let us beat cancer beyond COVID-19. Thank you so much for being part of this historic cancer awareness drive.